Hello, my name is Kim Miller. I'm a lead profitability coach with Inspired Hygiene. I'm a columnist for RDH Magazine, a national speaker and writer, and the co-founder of PerioFrogs.com. PerioFrogs.com. Often I am asked, how do I stay motivated as a clinician, as a hygienist? And I have a couple of tips for you when it comes to staying motivated. The first one is to be sure that you are analyzing and looking at every patient's individual risk factors. Risk factors would include things like diabetes, heart disease, autoimmune disorder, anything that has inflammation at its core. If the patient's medical systemic health reflects a great deal of inflammation, it makes treating their inflammation in their mouth, their periodontal disease, all that much more urgent and much more important. There's a list of red flags that you can access by visiting www.theheartattackandstrokepreventioncenter.com. And yes, you've got to type the whole thing out. And when you get to the website, if you go under the resources tab, the first thing you're going to come across is the red flags warning, and you can download this document. This document was produced by Dr. Amy Doneen, and she gives us a list of inflammatory conditions that our patients may have from a medical systemic standpoint that are a reflection of the level of overall systemic inflammation that the patient has. So when I think about this from an inflammatory burden that my patient's body is trying to deal with, the more risk factors they have for inflammation, the more urgently I would like them to treat their periodontal disease, because by lowering the inflammatory aspect of their periodontal disease, I can help them reduce their overall medical systemic inflammatory burden. The other thing that I want to talk about when it comes to staying motivated is this might indeed be your last opportunity to visit with that patient. Right? We never know when our patients are moving or they might be changing dentists for some reason. Take that moment. Every moment we have with a patient is something really special. Take that moment as though it were your last opportunity to educate each and every one of your patients about the dangers of medical systemic inflammation. And really, I can't help them with the rest of that, but I can help them with their periodontal disease. So look at it as though it was your last opportunity. Reflect on the patient's risk factors and remind yourself, I might not have another chance to talk with this patient about the importance of treating their gum disease.